And the
Okay, so they're talking about the borders of the femoral triangle. Okay, lateral border is what?
the medial.
sartorius,
Right.
medial border. And medially it has the adductor longus.
Right here.
Yeah, that's adductor longus sartorius. The base, the upper border is
The inguinal ligament.
inguinal ligament.
Okay, and then the inferior or the apex is formed by the overlapping of the medial and lateral boundaries, which is the sartorius.
Sartorius and
And the-
abductor longus.
Right.
Yes.
So just highlight the triangle area, the whole area.
Can we have a
That's right.
Yes.
Okay, so right here, this is the medial
Right.
border.
Right.
The
Lateral
lateral
border.
border, and then
and
this is the inguinal ligament.
That's the inguinal ligament. Correct. So
Mhm.
okay. So how about the floor?
The floor is formed by the
Adductor
adductor
longus.
longus,
Right.
pectineus,
Pectineus.
and the iliopsoas.
Okay. So this is the adductor longus here.
Yes.
Pectineus.
This pectineus, and this is
The
Iliopsoas.
Iliopsoas.
okay. From lateral to medial, we have the iliopsoas, pectineus, and adductor longus. Good.
Okay, so the contents.
The contents. Let's go to contents.
The contents is the femoral nerve, and then the femoral artery, and the femoral vein.
Okay, so the best way to memorize is van. Just remember it as van, but medial to lateral. Medial to go from medial to lateral is this. Say it again. From medial to lateral.
From medial, it
Show
is
it.
the femoral vein.
Vein. Okay, so it starts with van, vein, V-A-N. Van. Medial to lateral, femoral vein, and then
Vein,
The artery and the nerve.
femoral
the
artery and
then the nerve.
femoral nerve. Right. Okay.
And it also has it also has the lymph nodes and the vessels.
Right.
Okay, and the femoral artery and the vein and the canal of the lymph nodes, it is there's
They're covered by a sheath.
Covered by a sheath, and that is referred to as the
Femoral
femoral sheath. So femoral sheath is covered by it covers the femoral vein, artery, and femoral canal. Inside the femoral canal, what's located inside the femoral canal?
the
Deep inguinal lymph node, and the name of this node is node of Cloquet or node of Rosenmüller. Rosenmüller. Okay, right. Okay.
so the nerve
And
is not
so the superficial part of this canal is superficial inguinal ring.
yes.
And clinically this is important. Why? Because the loops of the intestine might herniate. So you would end up having what? A femoral hernia. And the femoral hernia opens to the saphenous hiatus. So what is saphenous hiatus? That's the area where the great saphenous vein drains into the femoral vein, and it passes through a fascia, and that fascia is referred to as cribriform fascia. Okay, so this area, so you have the fascia lata, and this area is basically deficient of fascia lata. That is the saphenous hiatus. Okay, and so basically the canal opens to the saphenous hiatus, and the other part, the initial entrance of this canal is the superficial, the ring, the femoral ring, and that is basically filled with fatty tissue, but still that opens to the abdominal cavity, where if there's an intra-abdominal pressure increase, so the loops of the intestine would go through this ring to the canal and open to the saphenous hiatus, forming a femoral hernia. So basically all femoral hernia occurs below the inguinal ligament. The inguinal hernias occur above the inguinal ligament. Okay, good. That's it?
That's it.
Okay, ask the question.
Okay, what passes through the femoral sheath?
Femoral vein.
Okay, what is located in the femoral sheath?
Yes.
Femoral vein, femoral artery.
The femoral vein, the femoral canal,
Are they correct?
without
Yes.
Yes, without the nerve.
Without the nerve, yeah.
Okay.